there's been a study done that the majority of this particular group that I'm familiar with is about 20,000 employees, and let's say about 14,000 of them are hourly. The majority of those 14,000 right now believe that in January, healthcare is going to be free. And that is not true. So I think that's an interesting thing, that why this particular group came out and said this. You know, we really think there's about 22 million Americans that are uninsured, and that's the really lower paid people, or you know, people who do not have jobs. Okay, people that would like it but can't get it. About 22, 23 million. This study says that after BPACA, after it's fully implemented, there's still going to be about 22 million people that are uninsured, and we're all in this room. If you own a piece of property, let's say, you're contributing to the health care for those 22 million right now, for Parkland Hospital if you live here in Dallas. So I think right now it's about half of my tax bill for my home-ish, somewhere in that neighborhood. So that'll be disappointing. If that ends up being true, and we spend all this money, and that realization comes because there's a lot of people that are going to go. I'm going to tell you a few of the things maybe you already know, but there's a lot of people who are making $20,000 a year and are going to say, I don't want your insurance because you're going to charge me too much, and the exchanges is not free. It's not free. Well, I'm not paying. It's free to me right now. I just go to Parkland. So they're going to say no. And currently, they're only going to be charged $95. That's their penalty right now. I think they call it a fee or a tax or something. So they'll pay the $95, just annual, or 1% of their total household income. So if they're making $20,000, and whichever is larger. So if they're making $20,000 or something like that, but their spouse is making $30,000, it's 1% of that number, whichever is larger. 1% of the total household income. And that scales really quickly. By 2016, it's $700 for them. But that will probably still be a lot less than purchasing healthcare. That's why I think that we're still going to have a whole lot of people on the sidelines that are not going to be part of the healthcare. And the other thing that I think is interesting is that the health insurance community is very excited. I believe the health insurance carriers are very excited, and although they're having to pay a whole lot of fees here. One of the fees is, sorry I'm getting off of this, but this is interesting, but I think it's kind of dry for a general discussion, a big general discussion that we're having here about the fees. And I'll hit things that I think you'll find interesting. But I was going to say, one of the things they're going to add to insurance companies next year. They're telling the insurance companies, there's only about 4 of them. So that's not there used to be 15 to 20. Now there's 4. And they're going to, depending on how much portion of business they have in their country, they're going to be allocated a bill of $8 billion. So that's next year. And that scales up really quickly. Now, none of those carriers are going to pay that and have it hit their P&L without something else coming back in the door. So we're all going to be paying that, no matter how we're insured. We're all going to be paying that. Yeah.
Now, I would like to actually comment something that when this Obama healthcare came, they created a number of federally qualified clinics nationwide. There are over 10,000 clinics are there. I was in Washington D.C. for the national conference, and for example, they have actually a couple of clinics here in Dallas Fort Worth. One is there in Fort Worth, and I own a staffing company, so I recruit doctors for this clinic. So I was with the CEO of that clinic. I said, how many patients you saw last year? He said, we treated 30,000 patients, And where these patients, he said, majority of these patients, he says, they came from Mexico, Right. They are seeing the doctors for the first time, because he was saying that the doctor wanted to speak Spanish, So what they have not taken into account is tens of thousands of people who come here and take the free treatment, and they don't have the infrastructure or this, which is not really accounted into that, because this federally qualified clinic I've seen last year alone 15 million patients, Out of that, I would say 90% is not really accounted in any of this government figures. So it's going to be really, when it comes to it, it's going to be a real mess.
Yeah, it's going to be expensive. Yeah, you know, a lot of companies here employ a lot of Mexicans, and I'll tell you something very interesting. I'm married to a Mexican. It's hard to explain, but I do understand it culturally. I have magnanimous employers, have had for years, that have paid 100% of the the lower wage Mexican guys that do their heavy lifting in the warehouse or whatever. And some of them, 50 to 60 of them. I'm thinking of one company over there off of Denton Drive. They all have health insurance, they all have a drug card, and they have an ID card. And I would hire fluent Spanish-speaking people to give them the enrollment information of what they need to do when they want to go to the doctor and such. And then we did an analysis on their claims and to see how many of them even went. And I think it was less than 5% that had any claims whatsoever. Their card was registered at all. They just go to their little neighborhood little clinic, and they go to Parkland Hospital. Even if they have, and they're at Parkland Hospital, and they won't pull out their card because they were in that time frame, which is not but a few years ago, they were afraid of being identified. So I guess thinking they're illegal. So they never even pulled out the insurance card, even though this guy's paying $300 a month for it. So anyway, there's a lot of interesting pieces. I love these little clinics now. By the way, CVS Pharmacy, and I don't know if Papaca made that happen. I don't know. But the CVS Pharmacy, anybody go there to get something done? My wife,
Flu shots.
Yeah, my wife has gone, taking my son there to get a malaria shot. He needs that for going to college, I guess, and done other little things over there. And it's so convenient. And there's and I've seen it in practice. There's, I don't know what you call it, traveling kind of nurses and doctors. I forget the name. They'll be upset with me. It's they make. We've talked about it before.
White glove.
Huh?
White glove.
White glove. And white glove. I've seen it where a guy came out of a board meeting we were having. You came out, sat there for about 15 minutes with the gal, and she was answering questions, and then ended up giving him a Z-Pack. So he didn't have to spend, the hour or 2 hours to go to the doctor to get the Z-Pack. These people came right to him. So there's, I think, there's a lot of things that are going to get solved here, but I think the biggest problem from a cost perspective in that article, you remember that I thought it really pointed out something very interesting, that the lobbyist, you have to register your lobbyist, you have to tell the government how much you're spending for your lobbying. And in the healthcare, which is the Association of Hospitals, and all the other people interested in healthcare, the people that make these CAT scan machines that want to sell into healthcare, they spent together about 3 times more in lobbying the government in the last 10 years than even the military lobby, which was not, a distant second. And they were naming some others. And so what they they did very good at, they were able to keep the at the forefront. They were able to keep that it's what who pays. It's not how much you pay. Okay, did I say that correctly? So they want us to think we want to find somebody who will pay. Taxpayers and everything. It's not what we pay. It's not that we charge $70 for this. I don't mind them doing it, but I just think it's nice. It's important for us to know it. I think if they can get it, fine. But I think it's important for us to know things that are happening. Here's something I think was interesting too, and it's all about marketing. The private hospitals, the nonprofits, they were mentioning that all this revenue, they make about 12 to 15% off of the gross, which is a pretty high net number, paying no tax. So they were giving an example, some hospital in Connecticut, and I forget the totals, but they made about, let's say, $500 million in gross revenue, so 50, 60 million in net then that was just a year. And so they have to do something with that money. They're a nonprofit. Can't just, distribute it to the CEOs and CFOs and all the employees. So what they did was, and all of them have the same problem, they build stuff. They build bigger. You may be, watching that happening down here. But they have to build buildings, they have to build beds, they buy stuff. So they can't, otherwise they can't just remain to be nonprofits, right? So I think that's such a great article. You guys ought to read it. It's very interesting, and I think it's made some, but here's interesting. There were 3,000, in 1997, there were fewer than 3,000 CAT scan machines. And they average a year 3,800 scans at that time. In 2006, there were more than 10,000 in use. So I'm getting marketed to by Cooper right now. They've got a deep, dark MRI thing that I can go put my whole body through, and they can find anything in my body and just pay $1,000 for or whatever. I just joined Cooper, so they're actually calling me. We're going to give you a discount. Can you please come and use our machine? And but now in 2006, there's 10,000 in use, but there's an average of now 6,100 a year being used. So heck, I think I'm belaboring the point, but I think all of that stuff is important, and I think it's important that we become, all of these fees become more and more transparent, and then we can choose to go to Baylor and pay $1,000, or go to, well, it used to be Brookhaven. I don't even think Brookhaven exists anymore, but another hospital or an MRI machine down the street that's, charging $200, because there's no cost to these things.
But yes,
so
this is paid by the insurance companies. When you go, in regards to where you go,
generally speaking, it's paid by the insurance companies.
But yes, but they're going to have a cost. They're going to have a price that they will pay. They're not going to pay. They really don't care what the bill is, because it's going to say
right, the 50% of whatever the
MRI machine for this condition.
Yeah.
This is what we pay. So.
But the other part of that is doctors feel like they need to. Sir, Doc, you probably had to get a lot of tests, because many times you do it to protect yourself. You get tests to protect yourself from being sued later. So you have to, there's just so much interesting pieces to that. But all right, I'll go over some of these slides real quickly. Isn't it amazing that part of the new law is that they're charging 0.9% for all the millionaires that make $200,000 and above. So that amount of money, that the 0.9% generated, is it on this slide here? Almost $90 billion. I'm stunned by that. I wonder if that math is correct. It just can't be. It's a lot of dough. But that's in place now. So the next slide. Okay, the individual mandate, does there anybody not know that that's what's happening? So everybody needs to buy health insurance somehow or another, through your employer or through the exchanges that in theory are going to be up. Now some states have them already up and been using them. Massachusetts has been doing something like this for a long time, and I watched a program on that the other day. So fascinating what's happening there, but what was some of the most interesting facts about that? Maybe it'll come to me later, but